Welcome to Couples Therapy in 7 Words, Short Takes. Bruce, what are we talking about today?
Well, today I'm going to do a little rant about ADHD.
Ah,
Dun. I can almost hear people all over the place. Well, actually, I don't think that's a little self-important to me to say that they don't care that much about what I have to say. But by golly, I'm going to do some ranting about ADHD. There was an article that appeared in the New York Times, and for those of you who are hearing this, you can look in the notes that go along with this little short take, and I will give the reference in there. But there's an article that appeared in the New York Times that was discussing some new approaches to ADHD that a number of the people who were quite eminent in the field and had been studying it for decades were having some doubts about some of the assumptions they were making. And I looked at that article and I'm thinking, now look, let me put my relative lack of qualification on the table. I don't claim to be an expert on ADHD. I have not been diagnosed with ADHD. I have worked with hundreds of people who have been diagnosed with ADHD, but that's, they're not talking to me about that per se, either as their individual therapist or as their couple therapist. I've worked with lots of folks. I've seen it over the years. Having said all that, one of the things that has come up, they talk about in the article about ADHD is the researchers who have said for decades ADHD is a disease like diabetes. In fact, one of the most eminent people in the field refers to it as diabetes of the mind, where what he's referring to, he's not saying it's literally diabetes, but he's saying it's like you have this thing, and if you don't take the right medicine for it, it will make you sicker, and you'll have all kinds of terrible things will happen. If your children resist taking it, or if your college students who have ADHD resist taking it, that's like a diabetic refusing to take insulin, and you should make sure that they are not among those kids that suffer all those terrible things that happen when they aren't treating their ADHD. Meanwhile, back in reality, and this is what the article talks about, when they follow people longitudinally, they discover some really fascinating things. First of all, on the average, medication helps out with ADHD for a year or so maybe, and then it seems to not help most people. And of course, associated with the medications, the traditional medications, which are basically, speed, they're amphetamines, basically. Associated with that are a bunch of side effects that are generally written off as, well, yes, there are these side effects that it messes with their appetite. And some of the kids are saying, I used to be funny and I'm not funny when I'm on this medication. And the answer to that is, well, maybe you're the wrong kind of funny. That is the hallmark of the kind of thinking that we did another short take on hardening of the categories. That is the hallmark of hardening of the categories. You can't see what you're looking at. You can't see the evidence for what you're looking at being simply wrong, mal thought. I will state it definitively, non-expert that I am. ADHD is not a black and white phenomenon. ADHD, like everything else, is a spectrum. It is a range of ways of being, and if you get far enough to one end of it, you attract the diagnosis. And what was fascinating in that article is they talk about all these people who come to discover that when they get themselves into an environment that is well suited to the way their brain works, it works a lot better. School sucks for the kids who get that diagnosis, not because there's anything sick about those kids, but because, and I say this with great respect, as you know, I'm speaking to a retired educator here, I have great respect for teachers and administrators and how difficult all that is. But school sucks for kids who can't sit still and are bored by stuff.
yeah.
And get themselves into situations where they're not, and it seems to work a lot better.
As a teacher, you basically teach to the norm.
Yeah, of course.
Teachers, as much as we try, you just don't have enough hours in every day to accommodate everybody's little special needs, unfortunately.
Yeah.
Classrooms are not set up that way.
Yeah, of course. And they're not set up that way for good reason. It's understandable. And also the things that you are teaching are designed for kids who don't get that diagnosis. And you see all these examples of people who get that diagnosis as kids because they're, have a hard time with reading, and they have a hard time sitting still through the sort of curriculum that, that is pushed in schools. And yet they do great. They do great things in other areas because they find themselves in an environment where they can thrive. They're not. It's not a disorder, and yet we are still dosing people with dangerous medications And look, I have to throw in this little proviso. There are some kids whose behavior is so difficult to manage. I have tremendous sympathy for parents and teachers who will say, if we give this kid this medication, they become unbelievably easier to deal with, and they're so difficult otherwise. I'm not saying that shouldn't happen. I'm not saying that's a terrible thing. I'm just saying that the way people think about, the way people categorize people, turns out often to be utter nonsense. And you get a whole industry that is developed around seeing it that way, and you cause harm, not good. And I'll finish this little short take with one of my favorite anecdotes about this that I've been telling for years. When I was an intern back over 30 years ago, when I was an intern, I was working at a community mental health agency for their children and youth services part of it. And I was doing therapy with kids. And so I had this high school kid who came in, and I had been told shortly before the session they had done an assessment of this kid and diagnosed him with ADHD. Kid hadn't been told yet, and they said, no medication had been started yet or anything, but they had mentioned it to their teachers. They had a meeting about the kid, and they mentioned it to the teachers. So, kid comes in, and I'm saying, "Gee, how you doing?" And the kid said, "It's really weird. All of a sudden, all at school, all the teachers are being nice to me. I can't figure it out." Well, of course the teachers are being nice to him because they weren't acting like idiots toward him, thinking that he was a terrible kid, when actually he's one of those many, many kids who really has a hard time sitting through and being bored to tears by what they're doing. And so when they realize, oh, he's got a diagnosis, so we don't have to blame him, all of a sudden they start being nice to him, and his experience is very different. Now, I don't remember how it turned out with that kid. If it turned out that he actually started learning better, wouldn't be surprising if he could learn better, at least if he's not being treated like he's some sort of horrible person. He certainly was less miserable there. But whether he learned better or not, I don't know, because school is not well designed to teach kids who get that diagnosis. So that's my short take on ADHD.